If you've ever had sciatica, the first thing you know is that it's unlike any other pain. It starts in the lower back or the buttock, goes down the back of the thigh, continues through the calf, and sometimes reaches all the way to the foot. And the sensation is strange. Sometimes it's like a biting pain, other times it burns, and sometimes it tingles. It's hard to find a comfortable position to sleep, hard to sit down, even hard to put on your socks. And on top of that, everything that's said about sciatica in the doctor's office, on the internet, and in bar conversations is wrong. Today we're going to debunk 5 widespread beliefs about sciatica with real studies in hand, not just opinions. And in 20 years of practice, I can assure you I've seen a lot of people suffer more just because they believed any of these 5. People who had been taking pills for months without results, people who stretched every day thinking they were getting better, people convinced that their sciatica was caused by the piriformis muscle when it wasn't. Let's go through them one by one. And before we start with the first myth, just a quick thing. If you're interested in this kind of content, if you want access to my exercise routines, I have a free weekly newsletter where I share all this and much more. You can sign up by clicking up here, right on the card that appears in the top right corner, or you can also find it in the first comment or in the description. The link, you go there, leave your email, and you'll be all set. Now then, let's start with the first myth. Sciatica is a pinched nerve or a trapped nerve. This is the phrase you hear the most. I have a pinched nerve. My sciatic nerve is trapped. A vertebra is crushing the nerve. And it sounds good because it explains the pain in a simple and intuitive way. The problem is that anatomically it's not correct, and holding on to that idea leads you to make wrong decisions about your treatment. What actually happens is different. When sciatica appears due to a herniated disc, which is the most common cause, what gets compressed is not the sciatic nerve itself. What gets compressed is the nerve root, which is a very short section of the nerve, right, as it leaves the spinal cord through the hole in the vertebra. And in many cases there doesn't even need to be significant mechanical compression. It's enough for chemical inflammation to appear around that root. The hernia releases substances that irritate the nerve without needing to crush it. There are people with huge hernias on the MRI and no discomfort at all. There are people with tiny hernias and disabling pain. It's not a matter of size or how much it presses. It's a matter of how much it gets inflamed and how your nervous system interprets that signal. This isn't just an academic detail. This changes the treatment approach. If the belief is that you have to decompress a pinched, crushed nerve, the logical solution seems to be surgery, right? If the belief is that there's an inflamed and sensitized root, the logical solution is to reduce inflammation with modified movement, with exercise, and especially with time, which is what all modern sciatica treatment guidelines say. Myth number 2. If you have a hernia, it stays there forever. This is one of the most harmful myths because it emotionally crushes a lot of people. You get an MRI, a hernia shows up, and you accept that you're going to live with it for the rest of your life under a cloud of pain, fear of movement, and limitations. Well, the reality is completely different. That's what a systematic review published in Orthopedic Review says, which gathered follow-up studies with MRIs in patients with disc herniations. When those hernias are followed up over time, they don't stay the same. They gradually get reabsorbed. In the case of extruded disc herniations, which are the most dramatic on imaging, the largest and most voluminous, up to 66, they reduce in size spontaneously, without surgery, without injections, and a significant portion even disappears completely. How can this be? Because the disc material that comes out is treated by your body as something that shouldn't be there. The cells of the immune system, they recognize it, surround it, eat it, and eliminate it. It's not that the herniated part goes back into the disc, but rather that it gradually dissolves thanks to our immune system. This process takes from 3 to 9 months, and during that time, if you've taken care of yourself, if you've moved wisely, if you've done the right exercises, it's very likely that you'll reach the end of the process with the hernia much smaller or even non-existent, and with the pain practically resolved. That's why clinical guidelines recommend trying at least 3 months of conservative treatment before considering surgery in non-urgent sciatica cases. Myth number 3. Anti-inflammatories will make it go away. This is almost everyone's automatic reaction. It hurts. I take ibuprofen. The pain doesn't go down, so I take 2. It still hurts. I take 3, and so on for weeks, often with a stomach-protecting medication and often with hardly any improvement. Why don't anti-inflammatories work in sciatica the way people think they do? It was published by the Cochrane Library, which is the global reference for systematic reviews of medical treatments. They analyzed all the trials, all the serious studies on anti-inflammatories and sciatica, and the conclusions are clear. The reduction in pain is comparable to that of a placebo. There is a small benefit in overall improvement, but with very, very low quality evidence, and with more adverse effects. In other words, they don't work well, and they do cause harm. This doesn't mean that a single dose of ibuprofen can't help you during an acute episode. It means you shouldn't build your treatment around the pill. Sciatica doesn't get cured by anti-inflammatories, it goes away in spite of them, while the body does its job of reabsorbing and reducing inflammation. And taking it for a long time exposes you to ulcers, kidney damage, high blood pressure, and stomach problems, all because of a molecule that isn't treating the cause. I've seen it in my practice thousands of times. People who take endless medications when the solution is somewhere else.
Myth number 4. Stretching will take away my pain. This myth is fueled by the good intentions of many people, including certain professionals. Your glute hurts.
They tell you to stretch. The back of your thigh hurts. They tell you to stretch. And you start doing the pigeon pose, cat or cow, hamstring stretches, and many times it doesn't work. It actually gets worse. And you don't understand why.
It's normal. The reason is simple. The conventional stretches that most people know are designed for muscles, not for nerves. In sciatica, what you have is an irritated nerve root. When you stretch the back of your thigh with your leg straight,
what you're also doing is pulling the sciatic nerve from the foot upwards. If the root is inflamed, that pull is going to irritate it even more, and you leave the treatment with more pain than when you started.
What does work for lumbar radiculopathy, which is the technical name for sciatica, are exercises called neural glides, also known as neurodynamic exercises.
And these are very effective exercises, different from a stretch. The idea is not to put it under tension, but to get it to glide smoothly between the surrounding structures. One of the most well-known exercises is called the slider. And in published systematic reviews and meta-analyses, it has been shown that neurodynamics significantly reduces pain and disability in lumbar radiculopathy. And that's why it's not enough to just do any stretching video you find on the internet. You need a well-thought-out progressive exercise that's adapted to the phase you're in. On my channel, you will find several videos dedicated to this type of mobilization. I'll leave it for you right here in the upper right corner of the screen. Just click, you open it, and you'll see many exercises where you can work on that neural gliding gently with different levels of difficulty,
so you can gradually improve. Myth number 5 is another well-known one. The cause of sciatica is the piriformis. The piriformis muscle, I'm sure.
This myth has been especially popularized in the wellness world, even among physical therapists on social media. The picture of the glute with the piriformis muscle drawn on it.
The arrow, the technical name clearly labeled, and the magical solution. Stretch the piriformis and goodbye sciatica. Very eye-catching, very shareable, and in most cases an incorrect diagnosis. The data is clear. Real piriformis syndrome,
when the piriformis muscle in the glute compresses or irritates the sciatic nerve as it exits the pelvis, represents between 0.3 and 6% of all cases of sciatic pain. The vast majority of sciatica cases out there, in normal people like you and me, are not caused by the piriformis. They're not from the piriformis muscle, and they're of radicular origin, meaning the lumbar nerve root is irritated by a herniated disc or disc degeneration. And what's the problem with misdiagnosing yourself? Well, it's simple. If you treat yourself for piriformis syndrome, a condition you don't actually have, you won't get better. You'll be stretching a muscle that's not the culprit. You'll be massaging an area that's not the real problem. And meanwhile, the lumbar nerve root still isn't getting the treatment it needs. Which is different? Spinal mobility, neural glides, progressive strengthening, and pain education.
Labeling matters, and in sciatica, it matters a lot. These have been the 5 condensed myths. Pinched nerve? Not necessarily. An inflamed nerve root? Yes.
Herniated disc that stays forever, or reabsorption in most cases? Yes. Anti-inflammatories? No. Putting up with stomach damage is not treatment. Stretching? No. Neurodynamics and exercise designed to mobilize? Yes. Piriformis almost never. radiculopathy coming from the spine almost always. And one final idea I want to leave you with, because I think it's the most important of all. Sciatica, even though it's very painful, in most cases has a favorable outcome if properly managed. The people who recover best are not the ones who take the most pills, or stretch the most, or sign up for the latest trendy treatment. It's those who understand what's happening to them, the ones who learn to move during the process, the ones who listen to their body to give it the right stimulus. If you want to keep receiving content like this in your email, exercises you can do at home without equipment, studies explained in plain language. You already know that down here in the description and the first comment you have a link to join my weekly newsletter. I send it every week and it's completely free. Thank you so much from the bottom of my heart for staying until the end of the video, and of course I hope to see you in one of my other videos. Bye friends.